Hi, my name is Beth Zeller, and I am an occupational therapist and certified lymphedema therapist here at Vineyard Complementary Medicine. I don't just treat patients with lymphedema, I also treat all kinds of acute swelling and chronic edema and conditions with chronic inflammation. So I wanted to talk about the lymphatic system, how it works, what it does, and where things tend to go wrong and how we can treat them. So the lymphatic system is one of two circulatory systems in the body, and most people are familiar with the cardiovascular system. So there's a central pump, which is the heart, and blood goes through the arteries. There's a gas exchange at the capillaries, and then returns to the heart through veins. And so that's a closed system. The lymphatic system is an open system, so it doesn't make a circle, and there's no pump like the heart. So instead, it relies on pressure changes and movement of the body to help muscles move the fluid up through the lymphatic system. And it's made up of lymph fluid and lymph capillaries, lymph vessels. There are lymph nodes, and there are lymphatic organs. And so the function of the lymphatic system, there are four main functions. So the first is waste removal. So it sweeps and filters the interstitial space in the body, and it absorbs substances that are too big for the cardiovascular system to reabsorb. And then it is responsible for fluid balance and removal of extra fluid in the body. It's important for the immune system. It actually transports white blood cells to and from the lymph nodes and bone marrow, and also helps repel and destroy microorganisms and invaders with macrophages and natural killer cells. And then lastly, it helps absorb fat-soluble vitamins. So lymph fluid is made up of water. It's made up of all the cellular debris that it's removing, the immune cells, proteins and fats, and other substances that are found floating around like toxins. And so all these substances in the water are what we can typically feel during an evaluation. So an adipose fat tissue would be kind of soft, and then a lymph backup is a little firmer, and then a long-standing lymphedema is going to be with a lot of stagnation. Those substances are going to kind of bind together, and it's going to be a lot firmer, sometimes creating fibrosis or a big firmness that needs to be broken up. And so that's also why lymphedema can't only be treated with medication, because most medications remove the water from the body but leave behind all these substances. The body doesn't want all these substances floating around, so it pulls more water to help dilute it, and that becomes a circle. So why does the lymph fluid back up to begin with? There is dynamic insufficiency, and so that is where the lymph fluid is too much for a healthy lymphatic system. So the lymph system is working fine, but there's just too much of a lymph load, too much lymph fluid that it gets backed up. So this could be because of a sudden trauma. It can be exposure to chemicals and toxins that are creating more substances in the body that need to be removed. It could be from poor diet, dehydration. It could be the result of infection in the body, stress, and then medically we most commonly see from cardiac problems, kidney problems, and liver problems, that there is so much swelling that the lymph system becomes overwhelmed. So the second part is mechanical insufficiency. So this is where there is a typical amount of lymph load to be processed, but the lymph system itself isn't working properly, so there becomes a backup. So this could be due to a lot of reasons. One could be congenital disorder. So this would be a primary lymphedema. So there could be too few lymph nodes, too few lymph vessels. The lymph vessels could be too thin or too wide, and so that the lymph valves don't meet and there's a backflow of lymph fluid. Or there could be abnormal and incomplete vessels and lymph tissues, so that fluid enters the lymphatic system but then is able to flow out further up, and so it never stays in the lymph system to reach the heart to be removed. And so that is usually diagnosed before age 30. Some are diagnosed at birth, depending on what the problem with the lymphatic system is. But mechanical insufficiency can also be due to trauma, where the lymph system is physically damaged, surgery. So a lot of cancer diagnosis removes lymph nodes, or lymph nodes can be removed as part of cancer treatment. And so whenever lymph nodes are removed, that's a stage 0 lymphedema, because the lymph system has been insulted. And then there could be other surgeries where lymph vessels get cut, abdominoplasties, liposuctions, hip replacements, knee surgeries. So any surgery where the body is cut into, lymph vessels can be damaged. And sedentary lifestyle can also cause mechanical insufficiency, because the body is relying on movement to help move the fluid up. And if you take that away, the lymph system is essentially damaged. And then, infections to the lymphatic system can also cause mechanical insufficiency, and different illnesses can impact the function of the lymphatic system. The third is a combined insufficiency. So that starts out with a dynamic insufficiency. Something happens so that lymphatic load is too large. The lymphatic system tries to work faster and harder to remove that extra fluid, but over time it ends up weakening the lymphatic system. So the vessels of the lymph collectors weaken, and then the valves in the vessels also weaken, creating a backflow of the lymph fluid. I see this most frequently in patients that have chronic venous insufficiency, which is a condition in which it frequently happens as we age, or people that are on their feet a lot for their occupation, and fluid backs up leaks out of the capillaries, and there's swelling in the feet and legs. And so if this isn't treated, the lymph system tries to help move the fluid out. It makes it work harder and faster, and over time that wears out the the lymph system, and it creates a secondary lymphedema. So the original problem was venous insufficiency, but it also becomes a lymphedema. And so why does this need to be treated? If untreated, we start to see skin changes. There's thickening of the skin, discoloration. There are other dermal disruptions that can occur, fibrosis, that firmness. It can cause ulcerations, and you're more likely to get infections. It can cause large lobules to develop, elephantitis, and then in some cases it can turn into, if untreated, lymphedema can turn into a cancer of the lymph system as well. So how do we treat this? So the gold standard for treating lymphedema is complete decongestive therapy. And these components are also helpful to other kinds of edema and other conditions that are affected by the immune system and inflammation in the body. So the first thing that we talk about is skincare. So when there is swelling, we have to make sure that the skin stays nice and healthy. Any dryness and cracks are locations where illness and infections can creep in, and because of the swelling, the lymph system is already overloaded and not able to process infections and fight them as easily. The second thing is we want to lower the toxic load of the lymph system, so we want to use healthy products that aren't adding kind of more debris to the body. We want to also make sure that we don't have any cuts, bug bites, bumps and bruises that are all going to cause more swelling to come to the area as a natural body response. And we want to monitor any skin changes. If there are any cuts, we want to make sure that they are treated and don't turn into an infection as well. Then the second component is exercise. So deep breathing is a big part of that, as it really helps move a lot of the lymph fluid through changes in pressure. And then there are a lot of small exercises that can help move fluid up through the body as well, and also exercises that, due to position change, can change the pressure in the body that help move fluid up as well, or down towards the heart. The next thing is compression. And compression is a very broad topic because there are all kinds of compression. So a lot of people have tried the white TED stockings in the past and say they're uncomfortable and they're too difficult to put on and they roll down. And that is absolutely possible. They're low quality, they're not meant to be worn for a long time, and they are difficult to put on. So there are a lot of other types of compression that work much better, that don't roll down, that fit, they're more comfortable, easier to put on. There's also a lot of adaptive equipment that can be used to make it easier to put compression stockings on. One of my favorite types of compression is called compression wraps, and they are a neoprene wrap with Velcro that get fastened around the body to help move fluid out. They're great because they're adjustable in size and adjustable in amount of compression that you can apply, because in the initial stages with fibrosis you might need a higher compression, but then in the maintenance phase it doesn't need to be quite as tight. Then there are things like compression pumps, which are big boots that go over the arm or the leg or even at the trunk that inflate to cause a pressure sequentially moving up the body towards the heart to help move the fluid as well. And let's see, and then of course there's also bandaging, and there are a lot of different types of bandaging. Bandaging is usually used in the first phase of lymphedema treatment to help break up fibrosis and move fluid out more quickly. But not everybody needs bandaging, not everybody can tolerate bandaging, but it's another tool that we have within the compression world. Then my favorite is the manual lymph drainage. This is usually talked about as a lymphatic massage, but it's actually not a massage. It doesn't have to do with the muscles, but is a light stretch of the skin that pulls on anchoring filaments in the body that helps to kind of dilate the lymph vessels. And there's a quick change in pressure when you let go. That's actually the working phase that helps move fluid up, and it also helps the lymph system work faster and harder. In a lot of conditions, the blockages in the lymph system can be due to scar tissue or the fibrosis, especially when it's caused by a radiation therapy or a surgical scar. So helping to break those up can help restore lymph flow and decrease the lymphedema. But in some cases, we need to reroute the fluid to other parts of the body or around blockages, and we do that with manual lymph drainage as well. One of the great things about manual lymph drainage is it stimulates the lymphatic system. So we know that the lymphatic system is a huge part of waste removal and toxin removal. So the thought is that stimulating the manual lymph the lymph system with manual lymph drainage is going to increase the work of the lymph system and help patients detoxify faster. Similarly, we know it's part of the immune system. So the thought is that by stimulating the lymphatic system, we're boosting the immune system and can help fight infections better. So there are a lot of conditions like fibromyalgia and chronic fatigue syndrome and Lyme disease that are using manual lymph drainage as an ancillary approach to help improving health of patients. So manual lymph drainage and lymphedema therapy isn't just to treat lymphedema, but also a lot of other swelling and a lot of other health conditions that benefit from removal of toxins and a boost to the immune system. So So if you'd like to find out more, give us a call over at VCM. Thanks so much. Bye-bye.